External cephalic version, what exactly it is and what are the prerequisites, what a doctor looks into before performing external cephalic version, what are the success rate when it is done, and what are the complications associated. Hello, I'm Dr. Gitika and I'm consultant in BLK Max Hospital, New Delhi. So today we'll be discussing something about external cephalic version. Normally, most of the babies, they are in head down position towards the end of the pregnancy, but yes, in 3 to 4 out of 100 pregnancy, the baby buttocks can be in the lower part of the uterus. So the presenting part, the leading part of the baby can be the buttocks or the legs. This is known as breech presentation, and as I told, this occurs in 3 to 4% of the females. So how to go further with this? Breech presentation has its add-on complications when a breech mother goes for a vaginal delivery. So mostly we recommend a cesarean section because there are some complications which can occur during delivery. An alternative to going for cesarean section is that we can go for external cephalic version. That is towards the end of your pregnancy at around 37 weeks. Your baby can be turned into head down position. This is known as ECV or external cephalic version. But not all the females can undergo external cephalic version. The amount of fluid around the baby should be adequate. There should be no placenta previa, that is, the placenta should be in the upper location and it shouldn't be lower down in your womb or your uterus. Then there shouldn't be multiple pregnancy, there shouldn't be any add-on comorbidities, like you shouldn't be hypertensive, you shouldn't be diabetic, and you shouldn't have any other conditions which straight away says that you should go for a cesarean section other than breech. So there are definitely certain contraindications where external cephalic version cannot be done. So it's very important that the patient is thoroughly evaluated before external cephalic version. During external cephalic version, it is done in at a place which is nearer to operation theatre, because in point 5, I want you to be very mindful of it. So only in 1 out of 200 cases may land up in cesarean section, but it is like not that common. It is only 0.5%. Sometimes while turning the baby, the fetal heartbeat may deteriorate and we may have to take the patient for cesarean section, but this has to be properly counseled to the mother before ECV. That's why we are always doing ECV near the operation theatre. As I told, it is done around 37 weeks. In primees, it can be done around 36 weeks. In multis who already have 1 or more babies, it can be done around 37 weeks. It has a success rate of 50%, around 15%, 50%. So if we do ECV in 100 patients, in 50 patients we will have the success rate. So it is around 50% success rate is there, but definitely we have to rule out contraindication. We have to do a thorough ultrasound and fetal heart rate monitoring before ECV. We have to explain to the mother what exactly ECV is and take an informed consent from her, and telling her the benefits of the procedure and the risks associated with the procedure. There are some risks, like the patient can go into preterm labor, the placenta can get separated, fetal distress can occur, the membranes, water bag can get ruptured. So all these complications should always be discussed with the mother before you perform ECV. Talking about ECV as such, it causes mild to moderate pain to the mother. So sometimes we do give some muscle womb relaxing drugs which are known as tocolytics. These drugs are known to relax the uterus or the womb and make ECV more easy. So external cephalic version, it takes around few minutes to perform this procedure. But if we talk about the entire procedure, starting from the pre-procedure preparation to the post-procedure, it may takes 2 to 3 hours. So we have to do an ultrasound, we have to look for the fetal heartbeat before the procedure, then we have to do the procedure, then we have to observe the patient. Having some amount of decrease in the fetal heart rate immediately after the procedure is common, and normally it recovers back, but within few minutes if the fetal heart rate doesn't recover to normal, then we may have to take the patient for cesarean section. So this should be clearly mentioned in her informed consent that she may land up in cesarean section. Complications I have already told, success rates I have already told, so and contraindications have also been discussed. So if you have a breech baby, you have three options with you. If there are no contraindications, you can go for ECV, you can go for vaginal breech birth as well, or you can go for a planned cesarean section. Talking about vaginal breech birth, there are some definitive contraindications to vaginal breech birth. For example, if there is a footling presentation, if the feet of the baby are in the lower part of the uterus, it is a contraindication. If the head of the baby is hyperextended, this is also known as stargazing position. So in that case also we don't allow the breech babies to deliver vaginally. Third, if the weight of the baby is too low, less than 10 centile, less than 1.5 kg or more than 3.8 kg, that is also a contraindication to vaginal breech birth. So it's very important that these breech babies are evaluated thoroughly, and then we discuss with the women that what she wants to go with. She wants to go with ECV, she wants to go with vaginal breech birth, she wants to go with planned cesarean section. I hope this video was helpful. Thank you so much.